Hello everyone, myself Gayatri Pawar and my topic is ciprofloxacin. Ciprofloxacin is the most potent first generation fluoroquinolone active against a broad range of bacteria. The most susceptible ones are the aerobic gram-negative bacilli, especially the Enterobacteriaceae and the Neisseria. Now let's see interaction. Plasma concentration of theophylline, caffeine and warfarin is increased by ciprofloxacin due to inhibition of metabolism. CNS toxicity can occur by concurrent use of theophylline and fluoroquinolone. NSAIDs may enhance the CNS toxicity of fluoroquinolones. Seizures are reported. Antacids, sucralfate and iron salts given together reduces absorption of fluoroquinolone. Now, let's see uses of ciprofloxacin. As shown in figure, it is used to treat in eye infection, ear infection, bone and joint infection, in food poisoning, urinary tract infection, in pneumonia, gallbladder infection. Let's see one by one the uses of ciprofloxacin. Ciprofloxacin is effective in a broad range of infections because of wide spectrum bactericidal activity, oral efficacy, and good tolerability. It is being extensively employed for empirical therapy of any infection, but should not be used for minor cases or where gram-positive organisms or anaerobes are primarily causative. In severe infections, therapy may be initiated by IV infusion and then switched over to oral route. First of all, it is used in urinary tract infection and high cure rates even in complicated cases are seen. Second, in gonorrhea. Initially, ciprofloxacin was nearly 100% curative in non-PPNG as well as PPNG infections, but has become non-dependable now, therefore not used. In chancroid, ciprofloxacin 500 mg twice a day for 3 days is a second-line alternative drug to ceftriaxone. Fourth, in bacterial gastroenteritis. Currently, ciprofloxacin is the most commonly used drug for empirical therapy of diarrhea. 5. In typhoid, chloroamphenicol, ampicillin and cotrimoxazole became unreliable for treating typhoid many years back due to development of resistance. In India and elsewhere, up to 95% S. typhi isolates were sensitive to ciprofloxacin and it has been used as a first-line drug. However, increasing number of non-responsive cases are being reported. Ceftriaxone is more commonly used now. If the S. typhi strain is sensitive, ciprofloxacin given in a dose of 750 mg twice a day for 10 days is recommended. Sixth, in bone, soft tissue and gynecological and wound infections. They are caused by resistant staph and gram-negative bacteria mostly respond to ciprofloxacin. High cure rates have been obtained in osteomyelitis and joint infection but prolonged treatment with high doses. Seventh, in respiratory infections. In anthrax, ciprofloxacin is considered to be the drug of choice. Now let's see adverse effect of ciprofloxacin. Ciprofloxacin has good safety record and side effects occur in 10% patients but are generally mild and withdrawal is needed only in 1.5%. Adverse effects gastrointestinal in it causes nausea, vomiting, bad taste, anorexia. In CNS, dizziness, headache, restlessness, anxiety, insomnia, impairment of concentration and dexterity. It also causes skin hypersensitivity, rash, pruritus, photosensitivity, urticaria, swelling of lips, etc. Serious cutaneous reactions are rare. It causes tendonitis and tendon rupture. A few cases have occurred. Risk of tendon damage is higher in patients above 60 years of age and in those receiving corticosteroids. So due to reports of cartilage damage, fluoroquinolone should be used cautiously in children. Ciprofloxacin and other fluoroquinolones are contraindicated during the pregnancy. So Now let's see some MCQs. First, ciprofloxacin is a option A quinoline, B azole C isoquinoline drug, and D quinacridine drug. So correct option is A quinoline. Second, ciprofloxacin should not be used with theophylline because first option, it decreases the efficacy of theophylline, B, it increases the toxicity of theophylline, C, decreases absorption of theophylline, and D, decreases the efficacy of ciprofloxacin. So the correct option is B, it increases the toxicity of theophylline. Third, which of the following is a DNA virus inhibitor and thus disrupting bacterial DNA replication? First is ciprofloxacin, B is vancomycin, C chloroamphenicol, and D is streptomycin. So the correct option is ciprofloxacin. Fourth, you are counseling a new patient about initiating a combined oral contraceptive pill and you know that certain medications can affect the metabolism of OCPs. Which of the following medications could alter the metabolism of OCPs? And the correct answer is ciprofloxacin. Thank you.